Hello, and welcome to another Arthritis Wellness Conversation. I'm Sandra Sova, and today, as always, I am joined by a research scientist from Arthritis Research Canada and members of the Arthritis Patient Advisory Board. On the panel today is Dr. Jolanda Cibere, and from the Patient Advisory Board, joining us is Kelly, John, Trish, Allison, and Eileen. Thank you so much, everyone, for being here with us today. Our conversation, our topic today is telehealth 1 year later. Basically, we started up this project of the Arthritis Wellness Conversations a year ago when things changed in our climate and how we do things. And many of our medical appointments and transactions with our medical professionals have moved from in person to being virtual in some aspect. So let's talk about it. Let's talk about what's working, what we like, and where we might be going. So let's open up the floor for people to tell me what you are liking, what's working with telehealth.
Maybe I'll start. I really enjoy it. I find that because I've got an immune deficiency as well, I feel a little safer. I know that going into the doctor's office regularly in normal times, I would worry about that quite often. Quite often I would wait outside until they called me or whatever. Now I know that I'm free not to be in that office, and that makes a big difference to me.
I know one of the things that came up on from several of the replies were people talking about just the sheer convenience of it. What's that like?
I really liked the flexibility. I work Monday through Friday, 9 to 5 kind of thing. So often when I'd have to have an appointment, it always conflicts. So then in terms of the commute time and then the actual appointment and then commuting back, it often could take like sometimes up to 3 hours, where for like a 30 or 45-minute appointment. So now I'm in a meeting till 9 o'clock. I have an appointment at 10 and I don't have to leave anything early. And sometimes I find that I don't even need to notify my team, which is really nice.
Huge savings there.
For me, myself, telehealth has been, virtual health has been a game changer because living with chronic fatigue, traveling from point A to point B can be physically exhausting. And during appointments, I have found myself unable to kind of concentrate or remember what they're saying, or really be able to kind of communicate what I want to say because I'm exhausted from just traveling there. And then as well as like living on disability or being a single mom, it saves me so much time. It saves me money having to travel, trying to get babysitters and things like that. So usually when an appointment would take a good chunk of my day, and then I maybe would the next day be suffering from it because it was physically exhausting, I'm finding I have more time to spend with my kids, spend actually taking care of myself and doing things I want to do. And it's been like a game changer for appointments that are usually only take like 10 minutes for a prescription renewal. I've been for so long wishing I didn't have to go into my appointment or, travel by train or like an hour to go and do something that takes so little amount of time.
Mm-hmm.
I think that's the same for me is I really found the time saving. I've got time back for myself because the commute to my healthcare specialists and my providers, we were at least an hour to get to them. And also I'm not great in rush hour traffic, so the stress. So I found having the telehealth actually reduced some of my stress to go to and from my appointments. Also too is my GP has done a great job that if I have to do an in-person, she gets you to wait in your car and she'll call you to come up, and they only have 1 or 2 seats in their office. So I feel very safe and comfortable with the system that, and I don't know how each specialist or healthcare professional does it, but for me, I find that very reduces the stress that I can go in there and I'm not worried about catching another virus or something else when I'm in the doctor's office. So I find time saving and stress reduction.
I found that not only is it time saving and stress reducing, but it's a lot easier to get an appointment at a time that works for you. And then when you do actually have the appointment, the doctor tends to call you on time, more or less the exact time that they say that they're going to. In fact, I've even had the experience where they phoned me 5 minutes early, which is something that I've never seen before when going into a doctor's office. Often, if you're going to a live appointment, you end up waiting maybe a half hour, 45 minutes, maybe even as much as an hour. So obviously this is working really well for the medical profession as well. And prior to COVID, the availability of something like telehealth was practically zero. I think COVID actually precipitated the ability for medical people to actually do telehealth. They have a billing number now and so on that they can use for telehealth. So it's a brand new thing, kind of like Zoom, actually. Yeah.
Yeah, it is new, and then when those things started to change, it forced us to become more creative, and now it's become something that people are really quite familiar with. So a lot of really good things, for sure. What may be some of the barriers that are experiencing through telehealth or virtual appointments? What would some of the things be that aren't working?
So for some of these conditions or ailments that come up with us that are very physical and need a physical exam, it draws some problems, I guess. But at the same time, it removes those ones that didn't need to be seen in person. Mm-hmm. So it kind of makes things a bit easier.
Dr. Cibere, that was something that you touched on as well, of like sometimes an in-person examination is needed, especially for a disease such as arthritis.
Yeah, I think patients in general have embraced telehealth really well. And I think it works well when people are stable. But when they're not stable, when their arthritis is flaring, it's really hard to assess that on video or on telephone. And that's one of the drawbacks of using telehealth. So I think there's certain situations where we really still need to have the in-person visits. And I think that the way medicine is probably going to evolve, now that we've learned how to deal with telehealth a little bit better, I think it's going to be a model that it maybe incorporates both. And I think that's the ideal situation, because there's many things we can assess on the phone or on video, and other things clearly we cannot. Or if people are hearing impaired, that kind of communication is actually much tougher when you use telemedicine. And some patients simply do not want it. I certainly have had some patients tell me they don't want that. Yeah, so in those situations, physical exam is needed, and the offices are open for that.
And I would think that would be really valuable. Someone on the panel had mentioned it, is for the newly diagnosed, like for the initial appointments.
I think I brought that up, is that by now I've had this disease for 24 years. I know what I'm doing. I can fill out my function forms beforehand, know where my depression level is, things like that. And my rheumatologist also trusts me in that. Whereas if you're a brand new person, you need that reassurance at the beginning. There's so much that goes through your head. And maybe this will give us a dual system where the newcomers get a little bit more time, a little bit more in person, and those of us that are stable, maybe we can do the telehealth. But I do think it takes a relationship between you and your doctor, whether it's your GP, your rheumatologist, whoever it is. It's hard to go in cold.
Mm-hmm.
So I think also from my side of it is my level of competency with technology has increased. I've learned a lot in this last year. But I also know that I have some friends with arthritis that have struggled with trying to get computer systems or, devices and stuff to be able to access it. And also too, is some people on disability or seniors have a financial impact with telehealth. And so if it is cost prohibitive, it's not going to help them at all to try to get into telehealth. So I think the cost of telehealth can be prohibited.
Mm-hmm. That's a good point. Let's talk about the difference between a video appointment and an appointment over the phone. I know, Allison, you had some thoughts on that, on just where your personal preferences lie.
Yeah, I definitely prefer video. I find that there's a few things I don't like about phone calls. One of them being it's really hard to read what the doctor's doing. So I feel like I'm constantly worried, am I going too fast or am I going too slow? Are they able to take like the notes at the speed that I'm going? And so it's a bit just harder to read the situation. And so I prefer video because it's also a bit more, I find the communication easier for me.
Actually, I think that's still an area where there's a bit of a barrier for the whole telehealth thing. It seems to be very, very easy for people to pick up the phone and do everything over the phone because we've been doing that for hundreds of years, it seems. But the video side, I've noticed on the appointments that I had where video was involved, there was a bigger hassle in getting hooked up. The receptionist or people working for the doctor would take a while to get everything working. And so you had to have a little bit of a lead time before you actually got into the meeting and so on. And then the people conducting the session were a little bit less familiar with the video side of the equation than they are with the telephone. So I think maybe this is something that's going to come along as we do more and more of it. But certainly there is a barrier to doing the video side at this point in time. But having said that, once you do get hooked up with video, I did one appointment on FaceTime, and it was an appointment with a dermatologist, and he wanted to look at various things, my toes and that sort of stuff, so I could move this video around and show him things, and he actually felt that that was as good as being there as far as he was concerned. But there was a big hassle getting the meeting organized and so on, and making sure that the video was working properly. So it's kind of a barrier and a better system at the same time.
Kelly?
I will say that I've only done telehealth and one in person. And I guess because that trust relationship between myself and the doctor, and because she knows me really well as my GP and he knows me really well as my rheumatologist, we haven't had a problem. He knows and she knows that when I take my blood pressure, it's accurate to hers, that my equipment's in line. And really, I think because we've had a long-term relationship, it has helped. So we haven't had to have video chat so far.
Mm-hmm.
One of the things that I learned about telehealth is that telehealth is a term that's used for both telephone health and video health. So you have to specify whether it's a video conference or a telephone conference.
Well, there you go.
Trish?
So for me I like a hybrid. I've been on in-person, telephone, and video. And I find for the telephone, I really like getting my prescription refills on telephone. She faxes it directly to the pharmacy. I don't have to drive to the pharmacy. I don't have to see her. She just asks me a few questions. I do my own blood pressure like Kelly does. She writes that down, and we do everything really quickly. We're out of there in 5 minutes. Whereas before, that would have taken me a 2 and a bit or 2.5 hour appointment to get that and stuff. So I find I like telephone for that. But when I want to actually eye-to-eye contact with my specialist, I find then I really think that they understand me or they're getting me. I really find that's important for me, is the eye contact. And I find the video conferencing actually, as someone said, that they can look at your joints, or you stand up and you can walk and they see how your mobility is doing, if it's better or how you're doing. So I find I like a hybrid. So for some situations.
Yeah, I like the way that you describe that, because I mean it really makes sense too, because some of them it really over the telephone is great. But another one of the things that several people brought up as one of the things that are not so much of a plus is that connection. There is that relating as humans, and Eileen, you talked about the aspect of getting out of the house. Even like it's just like, so we lose that human connection.
Yeah, so sometimes when, especially going through the beginning portion of my diagnosis, when I'm trying to find my right medication on disability, I would spend a lot of time indoors, and when I did go out, it was probably only for my medical appointments. So having those kind of taken away does take away some of my outings and actually some of my physical activity, because physical activity necessarily isn't always just going to the gym. It could be the walking to the SkyTrain to get to your appointment. It could be going for the walk after your appointment to decompress what kind of news you have, or taking yourself out for lunch, or whatever. You know, I go by Vancouver General Hospital. There's some gorgeous beaches I walk over to usually with my appointments, and I found myself just missing, you know, days where I actually have a reason to put on mascara and some lip gloss or something, and not wear my pajamas, or actually see somebody in person. So it's been very isolating not having that face-to-face contact with even just my healthcare providers.
Yeah, I think from a social perspective, you know, the physical distancing is obviously important in a pandemic, but socially it has an impact, and you know, that to me, that's the biggest thing. And that's why I think a hybrid model of having some in-person appointments, even just for that reason, I find that some patients actually want to have that social contact. Of course, when you're in the midst of a third wave, you have to be careful and not, you know, do that. But when the lockdown eases, then, you know, we can go back to some hybrid model. And I hope in the future, medicine will evolve this way, that we can incorporate that so that we have that physical activity, social contact. And I think it's just easier to establish a rapport with patients, especially new patients, as you said earlier. It's so important to have that as a physician.
I want to talk a little something about this hybrid model, because I've tried different healthcare providers throughout the pandemic, from social worker to physiotherapist to occupational therapist to rheumatologist to neurologist, all via video health or telehealth. And sometimes those particular appointments have gone really well, like an OT. I was able to do things that I wasn't able to do with my OT by going in and seeing her, because I was able to show her with my laptop, this is my setup that I have for at home with my desk. And she's like, oh, this thing would help you. But it doesn't necessarily always work, because OTs can help you with fitting you for a wrist brace. So she had, instead of helping me fit for a wrist brace, she had to send me a list of wrist braces that she knows that are good. So I like the idea of a hybrid, because it doesn't work with every type, particularly mental health. I've actually really enjoyed doing over the phone, because with anxiety, like I just sometimes when I want to talk about impersonal things, eye contact is actually very difficult for me. So it's some ways it's been very relaxing.
And I think as everything goes along, we're learning along the way, both as clinicians and as patients. And I pose the question, as patients, do you find that your clinicians are up to speed and able to process and work with the technology? And I got a yes from everywhere, and I see that it's just going to be something that's probably going to become easier instead of a way that we do things. I can't remember who it was. Someone mentioned a desire to have a more secure platform. So I'd kind of like to ask, how do you feel I'd ask the comfort level of in-person appointments, but let's flip it around. And how safe and secure and comfortable do you feel having your medical appointments in a virtual format, be that telephone or video?
Well, as a physician, I can tell you that I get consent from my patients to do the virtual telehealth. Without that, I wouldn't be able to do it. And the consent includes, you know, letting people know what the security risks are potential risks are to their health information. You know, when you're on another person's computer, that information could be stolen. So we have to be a little bit careful and explain those concepts. So especially with elderly people who might not be familiar with technology, and then, but once they, you know, once they're okay with that, then I think that's a way to move forward. But I would always say that patients have to have the knowledge and agree to be able to do that.
Mm-hmm.
I find this an interesting conversation, Sandra, because I guess it was about 6 years ago, 5-6 years ago, that we had a speaker on at the Reach Out for Arthritis Research who was telling about telehealth, and he had set up a platform. And it was really sort of cutting edge at that point for
Right.
most people. And a lot of people said that they would not trust it. Now, if you went back to that same group today, I think you'd have a very different opinion.
Mm-hmm. Mm-hmm. Yeah, it's like you mentioned, Trish. It's hard to even want to say that there's been any upsides from this pandemic, but I think sort of forcing that that hand for us to get up to speed with the different forms of offering virtual care. I think that there's a real fit.
Actually, one of the interesting aspects that comes out of this conversation is, you know, Kelly brought up where we were 6-7 years ago, and we're talking about where we are today. If you think a bit about what's going to happen in the future, you know, you were talking at the beginning of the meeting about wearing Fitbits and these kinds of things. We're going to get more and more into technology that allows you to measure a whole bunch of things yourself and transmit them to your doctor, either via telephone or computer or whatever.
Mm-hmm.
And then the ability to talk about them can be done on the phone or on a video, or even go in and see them in person. So we're probably in quite a transitional phase on this whole telehealth exercise.
Mm-hmm. Yeah.
Sandra, as somebody who's lived in an outlying area, if you want to call it, out in the boonies, where you don't always have doctors, and there are a lot of people with arthritis that are in areas where maybe they don't even have a GP, they have a nurse practitioner. They've been ahead of us for a long time in that sense, that that's how we've been attacking some of these appointments, is a little bit of on site, but also a lot of telephone calls and things. And I think that this has brought, in a way, a little, and it's silly to say this, but I think it's brought a bit of equality to a few people, that we're now experiencing the differences. And granted, some of them are going into a nurse practitioner's office maybe, and the rheumatologist is talking to them about, you know, would you please check this for me or whatever. I just think it could become a little bit of an equity thing. I think it's got a lot of possibilities to make things a little bit easier for some.
I asked the question on the perception of quality of care for if it is an appointment that is where you actually don't need that physical examination of your joints, if the perception of the same level of quality of care was there. And I was hearing pretty positive from all sides. Does anyone have anything to share on that?
I would say, from my experience, that the hybrid model actually gives a higher quality of care because it introduces another dimension. It, you know, this time thing that everybody spoke about is really very, very real for everybody. And, you know, if you can pick up extra time because you don't have to get a prescription filled by going and visiting a physician and so on, that in itself improves the quality of care. But then also you can spend your time doing things that would be more conducive to better health as well. Like, you know, maybe you have more time to exercise, maybe you have more time to go out and do other things and so on. And so for me, that it enhances the quality of care, but it would have to be a hybrid model. You couldn't just do that all with telehealth.
One interesting fact that I got from the Canadian Rheumatology Association meeting was that rheumatologists are actually having less no-shows now that the virtual care or telehealth is an option. So that's, I think, a really important thing to take note of. And I was catching some vibe from some people speaking about their experience of a little bit less burnout in the day too, because they're it's exhausting seeing patients all day long. I understand that. So they have more time to actually focus on some other areas of work too.
Mm-hmm.
That's so true, because my GP's MOA said her day is a lot less stressful than it was before. It seems to be flowing. They have morning in-person appointments, and then the afternoon is all telehealth or video conferencing or telephone. And she said that their cancellation list and their no-shows has gone down so much. And also too is she just found her days go by a lot easier than they did prior.
I think there's so many advantages for anyone, but especially for those of us in the chronic illness community where things like fatigue are a major factor. I'm thinking this is really quite a win. And I know I'm quite proud and pleased of both sides, both from the clinicians and from the patients, how everyone's just sort of making this work.
Well, I think the corollary to what you've just said, Sandra, is that, we're here and we all seem to appreciate telehealth big time. Where do we go from here when this pandemic is over? Will we revert to the way we were before, or are we going to be able to preserve this hybrid model and move it on into the future?
I think telehealth is here to stay, and I think it'll just be better and better and better down the road.
I hope that for the rheumatologist's sake that it does stay. We all know there's a shortage of rheumatologists. We always wish there isn't, but if we can take a little less of their time but still keep the same quality of health at a reasonable price, then I think it's a win-win situation for everyone.
Yeah, I agree. I hope it stays too. I think it's been wonderful being able to take care of people this way this whole year, and I think we've all adapted well. But it all depends on, what the ministry decides in terms of whether these fee codes are going to remain in place and for what circumstances can we use them. But I'm pretty sure in some form this will move forward. I have no doubt about that.
Mm-hmm.
I've also been involved in a few research surveys regarding the last 12 months with Arthritis Research Canada, as well as arthritis consumer experts. And I found those surveys were quite interesting, the questions they were asking us and how in depth they were getting to find out and have data and information to say how we're dealing with this and how is it helping the patients and also the rheumatologists or the specialists. So I found a lot of those surveys were for me, I learned a lot just going through and doing those surveys.
Doing them. For myself, it's also a safety issue. Right now, my white blood count is down, low, and I'm sure that my rheumatologist is really glad that I'm not in his office. Every time you go into a medical situation, you've always got a chance, especially if you're immune compromised. It's got to be a win-win.
Definitely. My rheumatologist actually, she was diagnosed with COVID, but she called me for an appointment that I originally had booked for in person, but she called me and said, and I never ended up with COVID, thankfully, because it was via the phone, but I also have not been sick since before the pandemic kind of broke out. And that's a rare occurrence for me. I would get sick every few months and it would be taking forever to brush it off. And now I haven't been sick in a long time. I'm scared for when I do get sick, but it's been really nice having the year off.
Yeah, and so I mean, it's all that. It's like there's some upsides. Less crowds. Not only ourselves, which we've talked about it before. Those of us with these conditions, we've always been washing our hands and stuff and all this stuff. But now everyone else is doing it. So it's I'm glad. I'm hearing a lot of that too. That people are being really quite healthy, and that's amazing.
I have one thing I question though about telehealth, and going back to when I was very first diagnosed with rheumatoid arthritis, I was 29 and I had no idea arthritis could even be an autoimmune disease, or kind of the concept of what living with an autoimmune disease was like. So I don't know if it would have been good for me to be diagnosed and have to go through the kind of first year of it and doing the telehealth thing, and an ability for me to kind of process the news and to accept it and to kind of understand its severity. I feel like that face-to-face contact, being there with my rheumatologist, you know, being poked and prodded as much as I was, kind of helped me understand, like, I'm now living with a very serious illness. Whereas if it was just over a phone being told, hi, you have arthritis, I don't know if I would have been able to realize the severity of it.
I think that that's where it's really important that you still have the hands-on for a newly diagnosed or for an unstable. Because I've had people say to me, oh, my arthritis isn't active. You know, my hands are kind of sore, and I'll take a look at their hands and they're red and they're sore and they're swollen. But maybe they don't have that same knowledge that someone else does. So I think it's really important until you know this whole, it's a whole learning curve.
You guys make all great points. I mean, some of the wait lists I know have gone down for rheumatologists and maybe for other specialists. And I think all the positive aspects you described, it's so helpful to know that, you know, stress reduction and the time commitment, obviously. But I do agree with Kelly that, you know, and you, Aline, that newly diagnosed patients, that's where you need that personal interaction.
They need
and
that hand holding.
Yeah. And I was also going to say that, you know, in the only caveat to all this is that sometimes patients change very, very gradually. They don't realize it themselves. They just reduce their activity level. They manage somehow. But it's not clear that they're flaring because it happens so slowly. And this is where it's important to not just rely on telehealth.
I would like to thank everyone for their contributions and input. And I hope that those of you that are watching, if you have not had a telehealth or virtual appointment to address your arthritis, that I hope you will gain some insight from today's conversation, hearing from individuals just like you that are living with arthritis. Thanks so much, and we will see you next time. For more information, visit arthritisresearch.ca.